In CPT, identifying unhelpful beliefs is referred to as identifying stuck points. So you are looking for the places that an individual has gotten stuck and unable to recover from their trauma. And that is a result of thinking about or understanding it in a way that is unhealthy and maladaptive. So there are specific moments in CPT when you are exploring beliefs related to safety and related to trust and looking for potential stuck points around safety and trust. And in doing that and working from a culturally responsive stance, it is really important to distinguish between kind of overgeneralized problematic beliefs, right? Like no one is safe, the world is unsafe, versus very valid beliefs and concerns around safety. So for Mr. Johnson, as a Black male moving through his day-to-day in America, he rightfully has concerns about experiencing racism, about experiences of injustice, right, which had already occurred plenty of times in his life and can continue to occur on a day-to-day basis, quite frankly. And so what you do not want to do when you're doing cognitive processing therapy or any type of CBT, quite frankly, is to question someone's beliefs about the fact that racism could happen, that people could be racist. If you're familiar with any type of CBT or cognitive behavioral therapy, you're probably aware that there are times when you're distinguishing between kind of how likely is something to happen, probability, right? Like, is it a 50% chance? Is it an 80% chance? I caution against ever asking someone about the likelihood that a person is racist, right? Doing so is invalidating in and of itself. It can feel like you are questioning a person's experience of racism, like you are yet another person who doesn't believe them or is minimizing this experience. And so this is not a helpful thing to do when you are identifying and kind of challenging particular types of thoughts. That being said, overgeneralized beliefs about safety, about people, no one can be trusted, which can be very common, a common belief system that people have when they've experienced trauma, especially cumulative trauma. We can work with that, right? No one can be trusted. That is a great stuck point to go after. We want to be very attentive to these nuances when working with individuals of minoritized backgrounds and identities. So Black, Indigenous, people of color, LGBTQ individuals, people who identify with various types of minoritized identities, because we risk invalidating their experiences and actually enacting microaggressions within the therapeutic relationships. So microaggressions being those experiences or projections of different types of racism that aren't overt racism, but and are questioning of someone's experiences, right? It can fall into that microaggression category.